Victoria has reported another day of coronavirus cases below 50, so optimism is still strong that restrictions will be eased as planned. Reporter Stephanie Ferrier joins us now from Melbourne. So Stephanie, take us through those numbers that have come through in the last hour or so.
Hi Joe, yes, so we have 45 new cases of coronavirus detected. That is up 17 on yesterday's number, which was our lowest in 12 weeks. That was just down to 28 cases. But importantly, it does still drop our all-important 14-day rolling average down to 42.7. So that's lower than yesterday's figure, which was at 44.4. And of course, that is really important because we need to be below 50 new cases on that 14-day average in order to take the first step towards more relaxed rules on September the 28th. Another good sign is that our mystery cases have also fallen to just 73. In the regions, they're faring even better. They're now down to a rolling fortnightly average of just 2.3, and they have no mystery cases, and of course they've already got some relaxed rules there as well. In terms of the deaths, sadly we've had another 5 deaths recorded, so that does take Victoria's toll from coronavirus up to 750.
And Steph, take us through what the Premier has said about having a bit of room to move on this roadmap out.
Well, Melburnians, we're all just madly watching these figures and really carefully watching that 14-day average and hoping that we might be able to get out of these lockdowns as quickly as possible. Of course, the 28th of September, that date unfortunately is set in stone. We're not going to be moving any earlier than that, notwithstanding the fact that we're below the 50 mark. However, the Premier yesterday in his press conference did hint that there could be some hope for Melburnians. He said that if we are ahead of schedule at the finish, then he would adjust things. So hopefully that might mean that we might come out of some of those hard lockdowns earlier than the second step, which will be October the 26th.
And Steph, just take us through, because people from in Victoria, even some in Victoria, might not be aware of what step 2 or what step 3 is. So what is happening, if it goes to plan, what's happening from September the 28th? What will people be able to do? And then what will happen from October if the numbers are right as well?
Yeah, so the first step is going to, actually I've got to try and remember what happens with the September 28th, because to be honest, we're sort of more looking at that October the 25th, right, because that's the really important part. And the October the 25th is when we can see more businesses opening. So that's that step 3, which is where the regional part of Melbourne has already got to. So right, that allows things. For example, step 2, I know that from the 28th of September, there'll be things like some of the senior and junior students being able to go back to right, school in term 4. In step 3, we'll be seeing more things like larger gatherings outside. I believe that step 2 might be going out with 5 people outside, and then after right, that you'll be up to 10 people. There'll also be, the important thing though is with the step 3, that's when we actually come out of lockdown. So the curfew will disappear. There'll also be no more requirement to have those 4 main reasons for being able to leave your home. They will also disappear. We'll also see quite a few businesses being able to start to operate again as well. So that's really important.
Yeah, and what's a particular concern about Melbourne's southeast at the moment, or a particular local government area in Melbourne's southeast?
So in Melbourne southeast, there is a very worrying cluster. Yesterday's 28 new cases, 5 of those were connected to this cluster in the local government area of Casey. Now that takes into the suburbs of Hallam and Narre Warren. And what is really concerning is obviously they're trying to get a lay of the land of just where this virus might be lurking there. So they are urging as many people as possible to go and get tested, particularly if they've been to the Fountain Gate Shopping Centre between the 18th of August and the 6th of September. They do believe that this is connected to several households, and they're still trying to work out exactly how they are linked, and they don't have the very rapid response suburban teams for the health department teams ready yet. However, they're saying that they're effectively doing what those teams would be doing anyway by doing a lot of consultation with local community leaders, because it's a very diverse ethnic community, as well as local councils and local medical services. But we did hear from one of the GPs who's down there, Dr. Amina Azizi. Now, she is one of the GPs and said to ABC Radio Melbourne that she was concerned a lot of people there felt the stigma really of being associated as COVID positive. So there's a sense of shame in the community. So not enough people were going and getting tested when they did have symptoms. And she was also concerned about young people ignoring some of those lockdown restrictions as well.
Okay, Steph Ferrier reporting there from Melbourne. Now to the coronavirus situation in New South Wales. The numbers have just come through for the last 24 hours. So 6 new cases detected in New South Wales, and 5 of them are returned travellers in hotel quarantine. The other is linked to a previous case who attended Liverpool Hospital, and they've been in isolation. Almost 17,000 tests were completed in the reporting period. Yeah, so really good news there from New South Wales once again in terms of coronavirus. So 6 new cases and 5 of those in hotel quarantine. 5 in hotel quarantine. That Queensland border is not open to New South Wales people yet, but it will be open to people from the ACT from next Friday. People coming from the Territory will have to declare they haven't been to a hotspot, which is considered anywhere in New South Wales or Victoria. It means ACT residents will have to fly. They're not allowed to drive through New South Wales to enter Queensland. Deputy Premier Stephen Miles is encouraging Canberrans to consider taking a holiday to the Sunshine State.
We've been saying for some time now that for Queenslanders, Queensland is good to go. Well, now for Canberrans, Queensland is good to come. And so now is the time we would urge them to start thinking about coming up to Queensland for a holiday. This is timed to coincide with the school holidays in the ACT. It's a great chance for people to come and visit friends and relatives, or go to the reef, go to Cairns, go to one of our wonderful tourism hotspots. This is great news for the ACT, and of course is recognition of the fact that they have been some time now without any active cases.
The Prime Minister will use a meeting of the National Cabinet today to persuade state and territory leaders to increase the cap on international arrivals. After months of pressure, Scott Morrison has intervened, saying a cap on passengers allowed into the country on commercial flights will be increased to 6,000 next Friday. Political reporter Steph Dalzell has more from Parliament House in Canberra.
Borders will definitely, or likely to be, I should say, one of the major topics of discussion. Pressure has really been rising among the states since July, when that cap was introduced on international arrivals as a result of problems with Victoria's hotel quarantine program. So there are currently about 25,000 Australians stranded overseas as a result of the pandemic, although there are estimates there could be as many as 30,000 Australians. And at the moment, we're seeing about 4,000 Australians returning home each week on commercial flights. The Prime Minister, Scott Morrison, wants that increase to 6,000, but the sticking point will be Queensland and Western Australia. They've both said that they want significant Commonwealth support for that, because they want help to cover the cost of quarantining those returning passengers in hotels. The WA Premier Mark McGowan, the Labor leader there, was publicly angry yesterday over this, saying that he wasn't consulted. He said he felt ambushed over this announcement, over the Prime Minister's announcement to lift that cap to 6,000. So it will no doubt be a very interesting National Cabinet meeting today.
And what else is on the agenda?
So today they'll also be getting a briefing of the quality of their hotel quarantine programs. That review was commissioned in response to the Victorian outbreak, but it's actually running alongside the judicial inquiry into the hotel quarantine in Victoria. So former senior public servant Jane Holton headed the review, and she'll be giving a verbal briefing to the premiers and chief ministers today. The Health Minister Greg Hunt says that her review, or the findings of her review, have been overwhelmingly positive. Take a listen to what he had to say.
Around the country, The hotel quarantine system has worked well. Almost 2,500 cases have been detected in hotel quarantine. That's prevented those cases escaping to the community. We would have been a massively different country now, but for this system. Now, we know the consequences when there was a breach in Victoria, and we've lived, as have you, the challenges and the agonies. So we can see how fundamentally important it is both to bring Australians home on the one hand, but to protect Australians on the other.
And Steph, tell us about this $2 billion health package.
So, Joe, this program includes extending Medicare subsidies for telehealth consults for 6 months. So this $670 million scheme was introduced in the midst of the pandemic in March, and it allows patients to have consults with health practitioners like GPs or psychologists over video conferencing sites like Skype or Zoom rather than face-to-face. And there had been concern because this scheme was actually due to expire at the end of this month, and there was a lot of concern in the health sector, particularly among the mental health sector, about this expiring in less than 2 weeks, with a lot of mental health advocates saying now was not the time to be reducing these supports. But the government has announced it will be extending the subsidies for telehealth until March. It will also be extending other services, including free COVID-19 pathology tests. It will also be shoring up its PPE supplies and also continuing free home deliveries for pharmacy.